My name's Nathan Wood, 40 years old, have been fighting brain cancer for the last decade. I was fortunate enough to get like a 7-year break until things came back up a few years ago. We've been watching something closely for a little while, and then just something was definitely growing. So got into surgery pretty quickly, had GammaTiles that were inserted, and currently getting ready to undergo chemo.
New and emerging treatments in the world of brain tumors include this GammaTile Therapy. GammaTile Therapy is a bioresorbable collagen sponge with implanted cesium radiation seeds. These are collagen sponges that are actually embedded next to the brain once you remove a tumor.
What was different this time were these gamma tiles or gamma wafers that were left in there. So just these small, little, I guess, almost quarter-sized, but they're square, wafers that are put in there, and each of them have cesium, I think it is, radioactive little rods or seeds in there. Had those put in, and they essentially just leave them around the surgery site after they're done and close everything back up. The wafers themselves or whatever are biodegradable, so your brain just absorbs that. And then there's the radioactive material that gets a little bit less radioactive day over day over day, until the point where eventually it's kind of just some metal that's left up there, but not actively emitting radiation.
After a normal brain tumor surgery, when somebody needs radiation, we typically don't start for 3 to 4 weeks. We know a good amount of these tumors will recur within those 3 to 4 weeks. So by implanting these radiation tiles at the time of surgery, we avoid that delay and prevent any recurrence within those first few weeks.
It sucks that there's a tumor in your head. The most important thing is to get it out. The relief that comes from that is so much greater than the worry of having it done. It's hard, it's scary, it's totally normal to be scared, but just understanding that as soon as you fall asleep, as soon as that anesthesiologist kind of gets you knocked out, you're in great hands. That fear of having something that's in your head that's continuing to grow, that's gone. And that's worth, honestly, pretty much any surgery. I've told Dr. Bohnen so many times she's a miracle worker. Those aren't even my words. I mean, that's my wife, my parents, my siblings, my friends. Everyone I know is in agreement on that. She's operated on my brain twice now. I mean, really, in just a 2-year period. And I don't think there's a way to thank her enough. The fact that I had to have this surgery done again, the anxiety and worry about that dropped in half just finding out that it would be Dr. Bohnen again.